Hi, welcome to today's Askawayhealth Friday Live class. Thank you for joining me. I'm Dr. Sylvia, a general practitioner, and today we've got two great questions from my viewers that like us to tackle, and they're all around how the emergency pill works. So let's just dive straight in. I'm going to put up on the screen so that you can see the question with me. So this question says, I had unprotected sex on the 2nd of May 2022. On the 3rd of May, I went on my period. On the 4th, I took the emergency pill. I then had sex again on the 8th of May, and it was the last day of my period. I took the pill again on the 9th of May. Now my period is 6 days late. I did a test, it was negative. Now the questions. Could I be pregnant? Could it be the pill did not work? Are these side effects or what? Please assist. So genuine question, and we're going to go through the bits of information that they've provided because that would help us get to some form of answer. So this is someone who's taken the pill and is worried about whether or not it's worked. And if you're not aware, if you've not seen it, I do have a video on the channel, or a couple of videos where I talk about why the emergency pill might not have worked, and I also talk about signs that indicate whether or not the pill has worked. But let's get into this question, and I've got a series of images I'd like to share with you. You should be seeing the image I've got, which is of a calendar, and on this calendar I've put and color coded the different bits of information that we have, and that's what's important. That's what your doctor is considering, given the dates and the events that have happened. And please remember that this is an estimation exercise. I always say in my videos, it's an estimate. Even ovulation that we use ovulator predictor kits for example, these are still estimates based on body temperature or the nature of mucus and so on and so forth. But even in a lady with regular monthly periods, it is possible that ovulation might change from one month to the next, and you might say ovulation is going to happen on this particular date, but you may be off by a few hours or by a day or so. So there are still estimates, and even in the laboratory we haven't been able to narrow down to the very last second or hour or minute when a woman is ovulating. There's still estimates, but going by the information that our ladies provided to us, so she said to us that she had intercourse on the 2nd of May, and then her period started the following day. Then she took the emergency pill the day after that. So if you can see my calendar, the May 2022, we've got the meeting with her partner on the 2nd, and then her period started the day after and taking the pill on the following day. So this tells us that she's taking the pill 2 days after she met with her partner. This is good. It's within the recommended period where you're supposed to take the pill. And for the levonorgestrel example, progesterone pill, what you're asked to do, what you're recommended is to have the pill as soon as possible after intercourse, nothing longer than 72 hours. And what that means is the sooner you take it, within the hour, within the day, that is within the first 24 hours of meeting with your partner, then the more effective it is. If you leave it to day 3, the 72 hours, it's going to work, but its activity is less effective compared to if you're taking it on day 1. But she took it within 48 hours, so that's fine. She's still within the recommended period of time. Good. So let's go a little bit down the calendar. She then says we come to the 8th of May when she says she met with her partner again, and that was also the last day of her period, indicated by my sort of nice little pinky blood there. And and she took the pill again afterwards. Well done. Well done. And why am I saying well done? 2 reasons. Number 1, she took the pill as soon as possible after meeting with her partner. That's number 1. But the other thing, which I think we doctors and nurses who give advice about sexual health and using the pill sometimes forget to remind you that if you've taken the pill on a particular day, you know what the pill does. This is the emergency pill I'm talking about, please. We've got the levonorgestrel types, and we've got Ella, for example, the ulipristal type. If you don't know, if you're not familiar with them, please go and check out my playlist on smart birth control. I do talk about them there. But the point is that they work by delaying ovulation, according to the studies, for up to 5 days, the period of time within which you'd expect that viable sperm would have died off already. And then ovulation happens. So imagine you've taken the pill, it delays ovulation. So if ovulation is hanging back, it's waiting to happen, it is still going to happen. Please don't forget, it is still going to happen. And then you have intercourse again, and you're busy thinking, oh, I had had the pill a few days ago, I'm sorted. No, you're not, darling. So you would need to either have started a regular form of contraception, use the condom, or if you haven't done any of those things, you will need to take another pill because you're just about to ovulate. And with this second bit of intercourse, you could get pregnant. Okay, so that's why I said she's done the right thing. I gave her kudos twice because of, what she did. I've shaded the next few days along our calendar. I've color-coded them because they tell us a few interesting things. And to explain what they tell us, I need to take you to the month before. Remember, she told us that her period started on the 3rd of May. Now, that's useful information, especially if she has a regular cycle. Now, I don't know if she's got a regular cycle. And this is why when you bring these questions on YouTube, the response you get is very, very general because it's not the place where you can get the information you need that's specific to your need. But don't worry, we do have our email service on Askawayhealth where you can send an inquiry and I or my colleagues on the team will respond, and it's specific to your background, provide information that will help you make your decisions and so on. But anyway, back to our question. So we're going to go back into time and we're looking at April. So she told us that her period in May was on the 3rd. Assuming that she has a regular cycle, we can sort of predict when she may have had her period in April and when she might have ovulated. And that's what I've done in this on this calendar, just to give you an idea of how we sort of estimate these things. So possibly if she had her period on the 3rd of May, she would probably have been ovulating 14 days before. And again, these are estimates. Please don't forget they're estimates on the 14th of April. And that brings us to that interesting term, which if you're a regular viewer on my channel, you should be familiar with, your fertile window. But let me define it again, just in case you missed the lecture on fertile window. So your fertile window refers to that period where you are most likely in all of your cycle to fall pregnant, okay? And it is defined as the ovulation day and the 5 days just before it. Some people even count the day after ovulation because they're thinking the egg might survive sometimes up to 24-48 hours, but usually the egg survives 12 to 24 hours. So we're saying that your fertile window is a sort of 6-day period where if you have meet with your partner during that time, you're most likely to fall pregnant. And can I just add that in terms of falling pregnant during a woman's cycle, there's some days where it is less likely to happen. For example, during your periods, theoretically, those are the times less likely to happen. But according to the Faculty of Sexual and Reproductive Health, you could potentially fall pregnant at any point in your cycle except when you're during your menstrual period, and the most likely time is during your fertile window. So this is what this tells us. And why did I bring it up? Because I can pull that into the following month and identify her fertile window of May. So looking at it from a broad point of view, she met with her partner around the time of her period. So already she's in sort of the low risk of falling pregnant kind of area, which is fine. But there's always a little but. So that's why it is sensible to use the pill. Don't say, oh, well, this is a safe time. It's around my period. I'm not going to fall pregnant. Please take it as soon as possible after unprotected sex. The 17th of May would have been her ovulation day, given her date, given her period that she provided to us. So about 14 days. And again, is an estimate. So her fertile window would have been around the 12th to the 17th of May, but she'd already had intercourse. And then going by her date again, we can estimate that possibly, assuming she did not take these two pills, if they didn't interfere with her cycle, probably her next period would have come around the 31st of May or early into the month of June. So that's why I've got another color code and a drop of blood here. So that little bit of information that she's giving us tells us what's going on there. Let's go back to the question because I thought it was useful for you to have an understanding of the different terms, and we've gone through the details. So we got to the point where she took the pill again on the 9th of May, and I've said well done to her for doing that, and I explained why I've said so. And now her period is 6 days late. So remember, she was expecting her period to come probably around the 31st or very early in June, but at that point she was saying her period was 6 days late. She's done a test and it's negative. Could I be pregnant? Those of you paying attention will already be spotting and thinking, well, probably not, because, okay, not only did she take the pill, and she took the pill appropriately twice, but she was also in that period of time, that part of her cycle, that time of her month when the chance of pregnancy is lower. She was not within her fertile window. So could I be pregnant? Probably not. I can't tell her no. I can't tell her blank no. I can't do that. No one can do that. But we can estimate that probably not. Then she says, could it be the pill did not work? I get this question a lot. Could it be the pill did not work? It is always a possibility. It's always a possibility. But I would not say that the fact that she hasn't got a period is not because the pill did not work. I think it's rather the side effect of the pill. And again, it is on my channel. Lovely explanatory video. Please go and watch about the possible effects of the emergency pill on your period. So she's had not one, but 2 emergency pills. And yes, that could affect your cycle. At the very least, it would either delay the period, or it might bring it forward, or in some women, they have the period about the same time the pill doesn't do anything to their periods. But any of those scenarios could happen. So the fact is that in this instance, since she's taken 2 pills, taking more than one usually, we're told it's not harmful. There are no studies or evidence that suggest it could cause any harm. But the truth is that they could make your cycle irregular. And in some ladies, that might be that the next month's period is a little bit delayed, or the one after that. Sometimes we don't know how long it might last for before things come back to normal if she doesn't take any other hormones. So that is the answer to that question. I think it's really important that you shouldn't go away thinking that if you have a bleed or if you don't have a bleed, then that means the pill has worked or not. In my video, I said, no, you don't rely on any of those signs. Because some women may have implantation bleeding and they're thinking, okay, all right, that's fine, that's the pill that's worked, but the pill didn't and they're actually pregnant. So that is a possibility. So please bear that in mind in terms of the possible reasons or the things to do with whether or not the pill will work. Please let me know. Of course, you're free to send a question in if you wanted any more clarification on that particular one.